So in organizing this conference, Emily and I wanted to have the opportunity to bring together medical students from all the larger area schools in New York City to provide them exposure to the way that physicians have maintained advocacy and activism in their practice. We were applying to residency and we didn't feel equipped yet to go out and be a practicing physician without first getting this sort of exposure. So this was, I think, the first step for us in terms of getting everybody together, allowing an opportunity to engage, explore, and learn from each other and from physicians.
We hope today and today's work is just the beginning for many of you as you learn ways to advocate for critical health issues and for the individuals and communities who need your support. Thank you for being willing to challenge the systems and structures that stand in the way of all of us living healthy lives.
We have knowledge, we have something to say, and we are not empty vessels to be poured into by our institutions.
I attended the lobbying workshop, and I thought that was pretty practical. You know, a lot of these things are informative and you have people lecturing you and talking to you, and it's really inspiring, but it's also kind of rare when you have a chance to practice. It was a hands-on and it was a little bit of role play. It was useful for the future. I would definitely recommend this. It was great.
Find your voice and use it. Many of you have found it already and you are using it, but continue to do so. When you get to residency, things won't get easier, you'll get busier. Then you'll become an attending, then you may decide to go into government or practice clinical medicine for the rest of your life. Whatever you do, keep realizing that the fact that you've earned a white coat, a stethoscope, or a position of power as a nurse, nurse practitioner, whatever you are, however you serve your patient, realize that the greatest thing you can do is advocate for them on a daily basis.
So today I attended the criminal justice reform workshop. I would definitely recommend the workshop. I think it's really enlightening, and it's something I'll take to me as a practicing physician. I'll think about all the things that my patient may have gone through in prison and all the care that they didn't get, and now what do I need to do to make sure they get quality care.
Now let me tell you what happens when you take your advocacy and decide that you're going to work within the system that sometimes has created institutional racism, sexism, and homophobia. If you have an environment where you're able to do the work, you're able to change an entire city, potentially an entire country if you do the right thing.
The biggest message for me, the takeaway from this, is that even as students and as future healthcare providers, our voice is so big. And we, I think, often underestimate that capacity. And we're at such a pivotal point in our careers and such an opportunity to do something about it that it's part of what we want to do. It's the Hippocratic Oath is about caring for patients and bringing about that change. And so advocacy and activism should be just as important as treating heart disease and diabetes as anything else. And so it's our time to shine.
At work has never mattered more. Physicians are at the precipice of having those conversations. The question is whether or not we are willing to move beyond all of the risk aversion that led us into this career to recognize that the fact that we're now here demands of us a certain moral clarity and a moral action that the world needs a lot right now. Now, the fact is that you all woke up to come here on a Sunday morning. That's pretty good moral action. The question is, can we take it further? Thank you.